Well, this is Amy, and she's volunteered to let us take a few pictures of her gums and help her show her how to take care of her teeth. Right now her gums are a little bit puffy, and she probably doesn't get underneath the gums sufficiently with the floss. So we're going to show her the gingival pocket or crevice where it's important to get under it with the floss. We're getting a close-up, and you can see the blood. I've scaled the teeth and got all the plaque off from in between there. But this is the little crevice here. That's, see how far down that probe goes? I get my head out of the way. And you can see that this is sort of laying over from this part in here, and when the two should be healed together and tight like that, and they're not. So what we're going to do is show, I'm going to use this floss thing, but you look with a mirror too, Amy, you can look. And we're going to slide this in between your teeth and hold it to one side and see we actually are going under the gum. You see that? Mm-hmm. And now the last thing we want to do is go over that way, or we'll do a gingivectomy, in other words cut the gum off. So we have to come up where it's tight and then slide down the other side. See? And then eventually you do this often enough, in about 2-3 weeks that's going to start to heal up there. So we just go around from one tooth to the other. It can be fast just like that. And what we don't want to do, because you see that's all cut up in between there now, we don't want to go in like this where it's going at an angle, because that's actually cutting that papilla right in two. Oh. So, and that'll make the thing worse, really. And if you look carefully with the camera, you can see it turning white right there. So it's stimulating the blood flow of the tissue, as well as getting it clean. Now we're going to take the brush, and we're going to, because the gums are so puffy, this is a real help here. We're going to take the brush, and just jiggle it, poke the bristles in at a 45-degree angle, and jiggle for about 20 strokes back and forth. And then we're going to move it. And watch how white that is. See how white that was when you push on it? That's white. And then so we're getting a change of circulation as well as getting it clean. And I think that, in my opinion, that stimulating the blood flow to that area and getting rid of that blood that's in there, which isn't really blood, it's infection. It's a sick blood, and after we get that sick blood out, food and oxygen is going to be transferred to that tissue, and it's going to start to heal. And then we do the same for back from the inside. And we're just going to go around all the teeth like that, just like we're going to have to go around all of them with a floss. The upper teeth the same way. We'll probably get that same whitening effect here. See how we're getting that. And then on the inside here, we're going to do it like this. And you just have to go all the way around your teeth like that. Okay, that's good. So, did you understand that?
Yes, I did.
Good for you.
Is there a special type of brush that we need to use?
Well,
like
yes, that's a good question. Yeah, I like a small, narrow-headed brush, somewhat like what we've got here. And it has to have soft bristles, otherwise you're going to tear on the gum. And it's not too particularly important the dentifrice you use. As a matter of fact, I'd like you to use as little as possible. And mouthwashes aren't going to do much for you either, but an oxygenating mouthwash in a situation like you got, like a tablespoon of peroxide and a tablespoon of water, and then put it in your mouth and just pump it between your teeth the best you can. But it's not important. What's important is getting the blood flow stimulated, like I showed you, with the floss and with the brush.
Okay, and we don't need toothpaste on it when we're doing it?
Well, just very, very little. And I really prefer a gel compared to
Paste.
paste because of the abrasiveness. I mean, I can have pictures I'll demonstrate at some point in time where people really cut into their tooth by using the toothbrush. And it's been shown that if you take the toothbrush and put toothpaste on a tooth like this, after about so many thousand revolutions, you cut the tooth right in two. So it's that abrasive.
Okay.
Even just the weight of the brush. So you don't, when I'm doing this, you don't have to jam the bristles in there. All you got to do is enough to make them flex, you know.
And how often should we do it?
Well, that's another good question. I would say once a day is enough. And I really don't care what time of the day you do it. Before you eat, after you eat. Ideally, before you go to bed is the best time. But
to do, now, how many times do I have to floss? The same thing?
Same thing.
Okay, so once a day for each of them?
All right. Because
Okay.
it takes about 24 to 36 hours for the floss to, for the plaque to build up on your teeth. And that's why my cleaning is, it's nice to get all that glunk off your teeth, but in 24 to 36 hours that plaque film is starting to build up in your mouth from the food you eat, but mostly just from the saliva and the bacteria in your mouth. And that's what absorbs sugars, and it also acts as a cover and produces toxins actually that dissolves your gum tissue, and that's why it's bleeding. And that's why it's swollen.
Okay.
Okay?
Yeah.
And then you can go into diet and not eat as many sugars and stuff like that, and breads and stuff like that, and concentrate more on, I'm not big on a lot of fruits, but a lot of vegetables and a lot of nuts and stuff like that, and meat's good, and vegetables, salads. You should eat a salad once a day. That's my opinion.
Yeah, I like salad. Good stuff.
And so that's about it in a nutshell. That's enough to get you started. Do you have any other questions?
How often should I get my teeth cleaned?
Well, every 6 months.
Every 6 months? Okay.
In your case, if you had heavier calcium particles, sometimes I recommend every 3 months.
Okay.
And you only had it's been a year, so it's not surprising you had quite a bit of junk on there.
Yeah.
But it's real important what you do every day as far as home care goes. And you can benefit your whole health by the dietary regime that we discussed. And I'll have more on the diet on my website, so you can look that up.
All right. Sounds great.